Greetings everyone. I am Agustino Simon, Bachelor of Physiotherapy, third year at Marad University. And today I'm going to talk about Myositis ossificans. Myositis ossificans is one of the complications of fracture. Let's take an example. Somebody got a fracture at the elbow joint. This is elbow joint. Now by the time of tissue healing, myositis ossificans can happen. So what is myositis ossificans? Myositis ossificans is the ossification of the hematoma around the joint. This results in the formation of mass of bone restricting the joint movement. And in most of the time, this restriction of the joint movement can be completely. That a person, after experiencing this myositis ossificans, he cannot even perform the movement of that joint. For example, initially before the fracture, he was able to do elbow extension and elbow flexion, but after this myositis ossificans, he can no longer perform this movement. Because of what? It is because of ossification. In a simple language, ossification is the abnormal formation of bone. Now, what happens in this complication of fracture is the bone formation leads to the stiffness of the joint, and this can be either due to the thickening of the capsule or due to the bone blocking the movement. And in some extreme cases, the bone may bridge the joint, resulting in the complete loss of the movement, as I said before. Now, we are going to the treatment of myositis ossificans. In its treatment, massage is strictly prohibited. So we are not allowed to do massage in this condition, because as you do massage, friction will be there in that location or in that joint. And as the friction is happening, ossification process will continue. So the bone will continue to grow and the range of motion will continue to be limited. In its early stage, we can treat it by rest. So the point should be put into rest in a time to avoid the friction or any pressure at that joint area. But when it is in the late stage, then we can use physiotherapy treatment. You can contact your physiotherapist and he can arrange the protocol for you. But when the condition is very much worse, then surgery. Surgery is prescribed when the condition is worse. What will be happening here is there will be excision of the part of the bone which was limiting the range of motion, the part which was ossified, which undergone ossification. And after this part to be removed by the surgeon, the range of motion can be regained again. Thank you.